Hi, welcome to The Vitals, Mount Sinai Health System's newest video podcast. I'm your host, Leslie Schlachter, a neurosurgery physician assistant here at Mount Sinai Hospital. Today, we're talking about loneliness. What is loneliness? What causes loneliness? And how can we treat loneliness? Turns out people don't usually make appointments because they're feeling lonely. They might call and speak to a lot of doctors' offices because they're lonely, but it's kind of a difficult diagnosis. But we do have specialists that can help diagnose loneliness and treat people appropriately. So we have 3 guests with us today. First, I'd like to welcome Dr. Fernando Carnavali, Associate Professor of Internal Medicine, Dr. Shawn Rhoads, Assistant Professor of Psychiatry and Neuroscience, and Dr. Marin, Assistant Professor of Psychiatry. Guys, thank you so much for being here.
Pleasure.
So did I intro that the right way? Nobody's really calling and saying, hey, I'm lonely. Can I come in for a consult, right?
Yes, you're right.
Yeah, but it is masked.
That does not happen.
It's masked in other things.
Correct.
Right? Yeah, so we'll get to talking about that today. Let's just first go around the table and in your own words, I want each of you guys to define your internal medicine, and you guys both specialize in psychiatry. Define loneliness the best that you can.
I think the best way that I will define it, just follow the Surgeon General approach to this, which is like really make a differentiation with the feeling of, we have a normal concept of feeling blue. It's just not like that. It's a little more complex like that and has some components that are just part of the society. It's not just only an individual problem. So it's complex and it's objective, correct? I mean, that's the difference between the social isolation and loneliness. It's just one is objective, the other one is not.
Okay. What about you? How would you define loneliness?
Absolutely, I would agree. It's about this subjective experience of feeling that you are lacking the amount of connection that would be meaningful and supportive to you. And I think that different people have different needs, and often that can change over the course of their lives, right? So needing more support, needing less support. And so I think that it's important to realize that it can be really a continuum of what loneliness can feel like. And sometimes loneliness can also be an okay thing, right? Sometimes loneliness can be a good thing. It can encourage us to, engage more and reach out to people, and be a motivator to be socially engaged. But I think it's when it's pervasive and continuous that's when loneliness can become a problem.
Okay.
Yeah, subjective experience. It's kind of like an experience of distress, really, too, I would say. This distress that you're lacking social connection, which is, I would say, a primary reward for a lot of us. Just like we would want to eat, right? It's kind of very similar to that, right? And we've kind of evolved in a way where loneliness is like a pretty good protective mechanism where we could, it kind of motivates us to go out and seek social interactions when we feel or perceive that we don't have them.
So the now former Surgeon General, Dr. Vivek Murthy, called loneliness a public health crisis. So what evidence do we have to support that claim?
There's plenty of evidence, and there are several articles, but what we know that from the report that we have 2 years ago by now, I think, it's 2023, if I'm correct. So, from cardiovascular health impact, mental health impact, obviously, and also infectious diseases impact. So we have impact in almost every single department when you think about your health individually. And the impact also is at a level of the society in general. And that's sort of something that we do not think, but it really is reflected sometimes in productivity at work, performance in school. So it goes beyond the individual.
Who is the most affected? Like, are there age groups that are more affected than others?
So I think that it tends to be, right now we're seeing a really large cohort in younger adults, but as a geriatric psychiatrist, I would say that I see it all the time in older adults, and I think that's sort of a second population that also experiences a lot of isolation and then also loneliness.
So break that up. Let's just focus on the younger crowd first. That's sad. Why? Why is the younger crowd lonely?
I think there are a lot of theories behind it, and I think a lot of people like to sort of blame technology a lot of the time, and how having that be sort of omnipresent in their lives from such a young age, it's really impacted their social relationships, their abilities to engage. I don't like to look at technology as being all good or all bad, because I also think it can actually really foster a lot of connection as well. But I think another thing that has really impacted younger adults was being young and also in the midst of COVID.
Right.
right? So I think that was definitely a really big impact on this generation feeling isolated and lonely. The times, in high school, in college, when we really, have so many social connections, and it's such a formative time to have that and be doing it alone in your room. I think it has really impacted that generation.
What's the difference for like the geriatric population?
So in the geriatric population, I feel that sometimes it's due to many of your social connections passing away, right? I think sometimes it has to do with and certainly not for everyone, but sometimes your world can get smaller, right? You retire, so you don't have those connections at work. Maybe family moves away, maybe your spouse died, or
maybe you leave your home in New York and move to Florida.
Which,
yeah,
seems like an awesome choice on a cold day. But, but I also think that a lot of the time medical conditions can isolate us. I had a patient the other day sort of saying that they didn't want to go to a show because they were worried about their ambulation and sort of having to walk with a cane. And, would it be a problem in that setting? And I think that certain things that, that conditions that happen to older adults also gets in the way in their ability to have robust social connections.
A lot of my patients post-operatively, if they have a deficit or they're walking differently or they're embarrassed by a walker, they'll stay home. They do not leave. They're embarrassed by how their mobility now.
Independently of at times, it's just the medications that we prescribe, and perhaps give some side effects that limit the way that you go through your day and the way that you plan where to go and with who to go. Perhaps you're taking a pain medication and you're very tired by 8 p.m. and that's that. So there are definite limitations. I think that from the report, what we learned that is these numbers of the younger people that it's just dramatic. Perhaps the older generations, the more senior people, this was just always there. And thinking about always there, but we know it's just when we talk about loneliness, just in the Bible, correct? I mean, in Genesis, they're talking about that. The Beatles with Penny Lane and Justin Bieber, a couple of years ago. So it's all over. It's not that new, I think. It's just perhaps the concern about loneliness is in the history of the world. But I think that we're more aware now, and we have the data that perhaps we didn't have before.
What are what brain effects are there from loneliness? Does this cause a chronic brain condition?
I don't know if it's entirely conclusive what the brain effects are. I know it's been linked to more inflammation, for example. I think blunted responses to social cues, for example, has been shown.
So can you compare that to let's say loneliness is difficult, right? Is there an ICD-10 code for loneliness?
You bet.
There is. Okay. I don't use it myself, but there is. Okay. What other socially acceptable diagnosis is there that would be similar to loneliness?
I think a lot of the time people come in discussing symptoms of depression, symptoms of anxiety, and that often when you sort of ask them a little bit more about what's going on, it turns out that really what's going on here is loneliness. That being said, you were sort of asking what brain conditions.
Right.
We know that loneliness increases your risk of depression, increases your risk of anxiety, increases your risk of cognitive impairment, increases your risk of your cognitive impairment worsening if you remain socially isolated. So there are definitely a lot of ways that we sort of see the two things influencing each other.
So you just said that loneliness can increase the risk for depression and all these other things. Does it work the other way around?
Absolutely, right?
Okay.
So I think that a lot of the time when people are depressed, one of the cardinal symptoms we see is anhedonia, a lack of enjoyment, a lack of desire, to do the things that they used to do. They have low energy, so it's hard for them to get out of the house. There are so many things in depression that can contribute to isolating yourself and then ultimately that leading to loneliness.
Okay, so let's just focus on the undiagnosed, not depression, no anxiety, no PTSD, just a healthy patient who is experiencing loneliness. How do you pick that up in your patients without maybe they don't even know it? And then how do you go about treating that?
It's a good question. I mean, and I was just thinking about what we can think about. Perhaps it's just going more into the elderly population. And for example, when they are just not moving around as much, correct? All of a sudden they are as you said, some stability is just lost. and all of a sudden they're not as comfortable going out for a walk, and again, in the normal conversation, it's just you start exploring what are they feeling with this decreasing motion that they're having and their ability to go out. And I think that then you explore that. But I do not know to what extent you don't end up with some degree of depression or anxiety, or just, if you want to call it, adjustment disorder at the beginning. I think it's just like...
What's an adjustment disorder?
I feel that we have the experts here. So,
what's an adjustment disorder? What does that mean?
So an adjustment disorder is often a constellation of symptoms that can look a lot like depression, can look a lot like anxiety, but don't meet full criteria for a major depressive episode or generalized anxiety disorder, and it's in the context of an acute stressor.
So when you say, I'm going to pull back even more. So for the people watching this, there are people like, I don't suffer from... I don't have depression, I don't have anxiety, but I can feel depressed and I can have anxiety, right? So there are actual diagnoses of these things. And there's criteria. It's the DSM, what number are we at now?
5.
DSM-5 is a book where there's criteria that then meet a diagnosis.
And I think the thing that is, like you said, being human means sometimes feeling lonely or sometimes feeling sad or sometimes feeling anxious. That's all part of our normal human experiences. But what the DSM says sort of again and again when you're reading the criteria, and it results in an impairment in functioning. Right? So it's about when these normal human experiences and emotions result in your no longer being able to function in your life the way you were before you were having these symptoms, and that they have to be sort of pervasive and constant.
So back to the patient in your office, because you're in internal medicine, you're kind of like the front line for these people, and you want to help someone. What are like your basic recommendations to help someone kind of get out of loneliness?
It's a good question, and I think that's the reason that we're here. I mean, do we have recommendations? And I think that the recommendations, in part, are at the level of the individual, but what are the resources that we have in society? And that's sort of the tricky part. And I think that we're not there yet. We don't have the skills developed enough to have all this information available. I mean, do we know what New York City has to offer next weekend? Can we tell?
Yeah.
And I don't know it at the top of my head. And perhaps we should start, having those tools available. I think that we can do much better.
And I think that we know that loneliness, like there's all these statistics, loneliness is equal to smoking 15 cigarettes a day, right? It's equal to drinking 6 drinks a night. And all the time we're screening for, do you smoke? Do you drink? And I think that part of that should be, are you lonely? And then sort of following the same trajectory of the way we treat someone who comes in with that, right? Someone comes in and they're smoking cigarettes, you educate them, here are the harms that can come from it.
Can you just say that statistic one more time? Being lonely is the equivalent of
smoking 15 cigarettes a day, which is a pack and 3/4 of a pack. 3/4 of a pack.
I'm glad I don't know how many cigarettes are in a pack.
So there are 20 cigarettes in a pack. So 15 cigarettes is a lot. It's a lot of cigarettes a day, or 6 alcoholic drinks a day, which is much higher than the recommended, safe amount. And so if someone came into my office and was saying they smoked 15 cigarettes a day, I would say, okay, well, let's talk about what the potential health consequences of that could be. And then I would assess their readiness to change, right? Because I'm not going to say, oh, okay, well, we can start Chantix, we can do this, we can do that, when it's like, I don't want to make a change. And I think that we should follow the same process with screening for loneliness the way we screen for substance use, and then assess, educating on, it's this has a greater risk of, increased risk of premature death, increased risk of cardiovascular illness, increased risk of psychiatric illness. And, have you thought about ways to change your life that may help with your loneliness? Are you interested in making a change? And then I think the important thing is you were sort of asking what can we refer people to? And I think that a lot of the time it's sort of, I like to see what the patients can come up with, right? As opposed to me saying, okay, here's a list of 15 senior centers in your area, you should go over here or go over here. That's a lot less likely to have them actually follow through and do it than for me to say, okay, well, can you tell me what are some things that you think you could do?
Well, what did you used to like doing? What used to make you happy?
Yeah, what used to make you happy? Or is there something that you've wanted to try? Or is there someone in your life who you think that you could reach out to more, right? Or what's getting in the way? of your reaching out to them more.
Does loneliness affect decision making and like cognitive decline?
I think the decision to, for example, go out and seek social connections. So in decision making, right, we have kind of this like expected outcomes, right, based on our behaviors in the world.
The brain is studied on imaging with neurodegenerative diseases, like traumatic injuries. Have we like studied the brain of lonely people? And lonely people not that have like depression and anxiety, but lonely people, just lonely people, period. Have we looked at those brains?
Yeah. So actually, I think there's kind of two. There's people who are like kind of chronically lonely, and then there's people that are kind of like transient lonely, like the short-term loneliness. There have been studies in both. One really interesting study is where they basically took people and they had them socially isolate for 12 hours and then looked at their brain responses to different social cues, like social interactions. And they also had the same people fast from food for 12 hours and then look at like social cues. And they found that people who were lonely, like experimentally manipulated loneliness, these people who are lonely had very similar neural responses to the social cues as they would after being after fasting and responding to food.
And so this is about intermittent fasting now.
Yeah. I will tell you, if somebody told me that I cannot communicate with a living soul for 12 hours, my brain would be so happy at the end of that 12 hours. I mean, I'm the opposite of a lonely person. Like, no, what is the opposite of lonely? Like, overly happy.
Well, but I think that solitude, right, is a state of being content with being lonely.
Right.
Being alone.
Again, so we're talking about the objectivity of it.
Content with being
when
alone.
we're talking about this, it's like how objectively you do not feel comfortable with where you are. And that's sort of like the loneliness that we're talking about. But I think just going back to what we said before, I think it would not be surprising for anybody that there's a stigma regarding that. I know that you mentioned about screening people. Since loneliness is a feeling, and the feeling is from your neck up, I don't have to tell you, but it's just like mental health of any sort, even if it's a reference to it, it's not really widely accepted, and it's just frowned upon. What are you asking me those questions for?
Yeah.
It's like we have problems sometimes asking what we use, which is these like 2 questions to screen you for depression, and people at times do not feel. So I think that while I agree that we need to screen, I don't know if we even have the tool to do it right. And again, all these tools will be different if you ask me with my background, you with your background, and so on and so forth. So it's very complex.
When someone's sitting in my office, they have very different expectations about what I'm going to ask them than when they're sitting in your office.
Right.
Completely.
Right? And so, but I do think that we're all getting a social history. And so sometimes I feel that maybe not even asking, do you feel lonely, but asking, who are your social supports? Mm-hmm. Right? And sometimes it can come up in different ways. I'm sure that when you have people coming out of surgery, who's going to come get you?
I can tell right away. I mean, part of surgical recovery is who's going to pick you up, who's going to be there. I have patients who have no friends, they're widowed. First of all, that's a difficult social discharge. But I can tell who my lonely patients are because they call for everything. They call if their toe hurts, if they have a fever of 99.9. I mean, I hear because they just want to call and talk to someone.
And I think the other part of that is also, we were talking about sort of the relationship between loneliness and anxiety, right? And so they may also be the patients who are more, concerned and maybe can't get, in the same way that I would maybe turn to my husband and say, I'm stressed, but he'd be like, it's okay, but if you don't have that sort of support built into your life and you're looking to your doctors for it.
It's a very interesting point that you bring in, because in that report that we were mentioning before, they're talking about like how families have changed in and how many people are just not married as before. And again, sort of, we're not really, saying, hey, everybody should get married tomorrow. But what we're pointing out that you're more isolated when you have this problem. You're in the middle of the night and your heart hurts and you think you have an MI. That's a different thing, as you just said. If you have Peter, Mary, or whoever by your side, it's like, I have a chest pain. And all of a sudden, it's just, again, it can be a big problem. But having somebody to just like share the experience makes a significant difference.
And it plays a role in terms of how loneliness can contribute to mortality, right? So
Correct.
individuals who have a heart attack and who have a spouse or someone else in the house to sort of, get medical attention or find them, are much more likely to survive, right? I think it impacts hospital readmissions,
Sure does.
right? I'm
Yep.
sure that after
Hospital discharge,
hospital readmission.
Yeah.
And ultimately, it's, and to sort of go back to what you were saying, there's the changes in terms of fewer nuclear families, more people living alone, but then there are also changes in terms of the way that people engage in their communities, right? I think that
Correct.
a lot of my older patients, grew up at a time where they were much more involved in religious communities, in unions, in all sort, Odd Fellow Club, all these sorts of things that don't really exist anymore to sort of as places to build community in the same.
Okay, so let's bring social media into this now,
Sure.
right? Because I'm so grateful that I grew up when I didn't even have email in high school. I got it in college. I didn't have my first smartphone until my 20s. I don't know what it's like to grow up on social media. So how are people more lonely with social media or less lonely with social media?
I think it depends on the person.
Yeah, I think in some ways social media has made us more connected than ever before,
Right.
But I guess it's like it might be the face-to-face interactions that are less frequent, and there's a little bit more of like being anonymous online as well. But yeah.
So I can imagine it's person dependent.
It's person dependent, but it's also, I think many people will have both, right? I think that sometimes it's not just the social media. It's like when I'm out to dinner with my friends, I'm checking my phone, and that's decreasing the the quality,
Yeah.
How you-
right?
yeah.
So even when you are having those in person, let's take a picture for, and sort of being less in the moment. So I think that there are impacts there, but there are definitely ways I think in which, speaking of our older patients with limited mobility, the ability to see me virtually,
Right.
the ability to do a group therapy with other people, the ability to join a support group, right? Or, I have many patients who go to AA virtually every single day.
Yeah.
Right. And, I don't think technology is, it's all good or it's all bad. But, in terms of with children, I like my school, for my kids' school, has a policy about sort of waiting until 8th grade until the kids start having phones. And I think that there's something about sort of that community coming together and making a decision about when kids can start having phones, when they can start using social media, so that they do get a chance to have this childhood and the social skills without having, let me check my phone in the middle of this conversation.
I think the bottom line is that there's not enough data. And some of the data is very concerning. I think that we all read them. Cyberbullying exists, and it's a problem.
Absolutely.
And we had people committing suicide because of that. So
Right.
we know that exists. Do we have enough data to see the impact and to measure? I guess that, as you said, you did not grow up with one of this.
Right.
So what about the people that are growing up with this? What will be the impact in 20 years or 30 years or 50 years? We have no clue. It's the bottom line. It is just a fight, and regarding the distraction, I remember, being with friends for the first time. I have just like the old-fashioned wristwatch that I love.
Doesn't beep at you
but
all day
many
long.
people have the Apple Watches. So
Yeah.
the first time that I was sitting down with somebody with an Apple Watch, and the person was just going like this, said, okay, do I have to go? What is this?
Yeah. Like, am I that boring?
No, I'm not that bored.
Yeah.
It's just like, no, it was just the messages that were just getting into that. It took me like half an hour to realize that actually I asked, what's going on? It's like, can you talk to me? You need to go, we just reschedule. No, I'm just checking my emails.
Or they may
Yeah,
not
but even
even
that,
realize.
that is like I'm not important enough to keep eye contact. You have to keep looking to see who it was.
But it just changes. Then all of a
It does,
sudden,
it
the
changes it.
vibe changes, correct? The vibe is not there anymore somewhat. So I agree with you. And so what's the impact of me being exposed to that and that relationship? It's just a question mark. We do not know. But it has like some concerning angles, I think.
So there's the good of social media and technology and such, and then the bad. What about things like smoking, cannabis, alcohol? Like a lot of those, like doing those things, coming together and meeting for a drink and socializing and maybe drinking a little too much or whatever. That's great. but it's also not good for you. Is it like the same idea?
Yeah, I think it's the same thing, right? Alcohol can be a social lubricant and can sort of, help bring people together, or maybe you're part of a community bar, but we also know that sometimes it can have, often it can have negative consequences as well. So I think it's about, it kind of, what is healthy for this person in this moment, right? And that can be very different from what is healthy for you, what is healthy for me. And I think it's the same thing with relationships to social media, with phone use, and I think that, yes, we absolutely know that certain things in that social media has been associated with increased risk of anxiety and depression and all of these things. But we also know that there are many people who find connection and community there.
Right.
But if I may, this is a perfect example, which you mentioned alcohol. So there's just a recent report also from the Search in general.
Right.
No quantity is good. Okay, so this is how information is evolving, correct? And so that was not the same message 10 years ago or 5 years ago. So where are we going to be with media and the effect on loneliness? God only knows. But again, I do believe that we can do better. Perhaps developing tools. Perhaps I didn't make myself clear. Not just only recommending senior. Sometimes I recommend. Okay, where's your near Y, and can you go to the Y and swim?
Right.
And again, I think that when they are in this state of loneliness, it's just not that easy to come with plans yourself. So you need to sort of help them find the way out. And it's possible. There are plenty of resources in your city. We're just lucky that way, that's for sure. And I think that, that's what I do with my patients. They appreciate, do they go, do they not go? That's a different story. Yeah. But at least we're doing it. But it's not uniform. And I agree with you, it should be more uniform with everybody. It would be an interesting little study to there.
But it's hard, right? We live in the city with so many people. You and I just, we're found out we live in the same building, and it's like, so we're surrounded by these people, but we at the same time are not.
Yeah.
Right?
So together, but so separate.
Exactly, and I think that sort of going back to the question of what can we help our patients do? What can we advise people to do? I struggle with that. Right? I have sort of my list of organizations that I refer them to, or we look at what their neighborhood, or we talk about what their interests are. You want to take an art class, the 92nd Street Y has some great stuff, right? But at the end of the day, there's a ton of resources and also not enough at all.
Yeah. Yeah. I tell my patients, I would say the majority of my patients are over 50. And you find out, it's really easy for me to weed out my lonely patients because they usually don't have a strong social network, or live alone, or widowed, or their family lives somewhere else. And I mask my loneliness treatment as surgical recovery program, which is really lovely because I don't have to say, hey, I know you're lonely. I say, listen, I need you to join a gym or get a trainer. I need you to go to the grocery store. I need you to walk back and forth to the grocery store or Barnes & Noble every day. For the patients I know are very lonely, I make them see me post-operatively every week for 6 weeks. They have to come to my office and see me in person to check their incision. I'm not billing for this. This is all in the global, but I mask my loneliness treatment in post-op recovery because I know if they don't get out and move and do things, it's not gonna work.
Sometimes it may take that initial behavioral activation is sort of what we would call it in psychiatry. Getting them out of the house, getting them to do things. That it's sort of like a body in motion stays in motion, right? So if you sort of start small and it's like, okay, well, I want you to start going to the grocery store instead of Fresh Direct. I want you to start. And then it grows, and I met someone there, and now we're gonna grab dinner.
And not even don't go to the grocery store twice a week. Go every single day for what you need that day.
Yeah.
It's make those trips. I want to just back up a little bit because, as sad as this sounds, loneliness in older people, very sad, right? Their world is changing. But let's talk about, this is mostly for the parents out there, or if kids are listening. Let's talk about loneliness that happens in children and teens, right? So let's just say, because a lot of us have experienced this, either ourselves or with friends or people, there's outcasts in school, right? Whether it's in kindergarten or 5th grade or whatever, for some reason, for whatever it means, maybe their clothes weren't nice or they had the wrong hairdo, kids can get outcasted and it sticks. And then they become lonely, and then they can even get bullied, and it can spiral from there. How do parents recognize loneliness, and I'm looking at like a geriatrics, I'm fully aware. But like, what are some of the things that parents could look for and be aware of and help make sure that doesn't develop in their children?
I would wonder, I would ask you, is that more objective or that would be not as objective? It's not sort of like
a
the
not
child
included
will...
kid.
I mean, it's hard, right? Like, I think that some kids are going to open up to their parents.
Yeah.
And
Or
let them
recognize,
know
or even recognize that that's what's going on.
Right.
You know?
But I think this is the same thing as how do we detect anxiety and depression in kids as well, who may not necessarily. So a lot of the time in kids, especially younger kids, they will have, instead of saying, I feel anxious, it'll be my tummy hurts.
Yes.
I have a headache. Right. And so, I think a lot of the time it's sort of these physical symptoms that are, and so instead of having recess, I need to go to the nurse. Right. And trying to look, okay, well, why is that happening? Are they trying to avoid the recess because there's some bullying happening, and sort of being sensitive that with kids, it may not always look exactly how we would think it would look in an older person.
Right.
They may not have the words to describe that they're feeling lonely in this. And I mean, not that all adults do as well, but I think it can be harder for children, and so it's really important for us to. I mean, I have two kids, and sort of tell me 3 things about your day is kind of the way we like to go around the dinner table.
Yeah.
And if you're noticing that the 3 things about the day are, I spent this period in the library, and that could be someone who likes to be alone. So just because a kid doesn't have a robust social group doesn't mean that they're lonely, but I think asking those follow-up questions like, oh, okay, like why did you do that, or how was it?
Yeah. I guess as long as they're saying they didn't eat lunch on the toilet alone.
Like that Mean Girls
correct?
scene.
I mean, performance.
Performance,
I mean,
yeah.
what we talk about, like the part of that is a little outside the person, how they're performing in their quote unquote duties, and that's very telling, I think, for children. But like, at least that's what I can tell from my children as well. How are you performing? It's just like, how well are you doing? And again, at times it's not that I'm not a pediatrician, just to clarify, but it's just as a parent, just try to measure the productivity, not because I want perfect grades, but just to be sure that there's no red flags.
Yeah. And it's the same thing in terms of work performance as well, right? We know that individuals who are lonely are more likely to have difficulty, are more likely to have difficulty at work, to feel less fulfilled at work, and so I do think that we see it starting with
Correct.
kids and their grades, and then sort of all the way up.
What are the long-term physical manifestations of loneliness?
Increased risk of cardiovascular disease and stroke, increased risk of diabetes, increased risk of developing hypertension. But it's not just the risk of developing, it's also an increased risk of difficulty with managing it, right? So if you have other people in your life to help remind you to take your medications, to help you get to the doctor's appointment that you need, to say, oh, I'm about to refill my meds. Do you want me to get them for you as well at the pharmacy?
Right.
So I think that these adherence, so not only the development of the illness, but as well as the adherence with medication can all be impacted.
So if it's leading to physical illnesses like that, what kind of hormonal changes, neurotransmitter changes are actually happening?
Oof. I mean, we know that there are neuroendocrine changes. You mentioned before that there's inflammation that happens.
Right.
I don't know personally.
Okay.
I don't know if we know exactly what the changes are that's happening, but we do see the correlations are very strong, right? So we do see an increased incidence of the diagnosis and also an increased risk of mortality.
So it's dangerous to be lonely.
That's what we said at the beginning. It's the first chapter in the Bible, so it's there. It's not good to be alone.
And this is probably just like well known, or where does it come from? But like one of the greatest predictors for long-term survival is having a strong social network.
Yeah.
This is like so.
But with we need to highlight what you said before. That this is very objective, correct? And we're not saying that being alone is a bad thing, but we recognize that for a subgroup of people, that can have a negative impact. And some people are well adjusted to being by themselves for months at a time. I mean, we're talking about the people that do not have that healthy adjustment to it.
And I think the other part of it is you can be surrounded by people and still feel lonely. Mm-hmm. So I think that loneliness does not necessarily mean being alone, right? You can have tons of people in your life, but not feel that the quality of those relationships are supporting you.
Oh, I feel lonely in my house several nights a week. My husband's sitting at his desk doing work. My daughter is on her whatever, and I'm just like sitting watching TV, and I'm like, how come we're not hanging out together?
Yeah,
why am I here by myself?
So I think
I recover from it very quickly, but I feel that way momentarily.
Good. That's good to know.
But we talked about that before, and how having those momentary feelings also forces you to then increase your social connectivity, right? So it's actually a good thing sometimes to have that feeling. Maybe it results in you walking into your daughter's room, sitting down on the bed and forcing her to get off her phone.
Yeah.
You know, like I think
or do her homework, preferably.
Yeah, exactly. Yeah, ideally. But I think that it's important that it's not about the volume of social contacts. It's about the quality of social contacts. Right. And what I need will be different from what you need.
What did you want to add to that? I saw you jumping in a little bit before. Or were you just emphatically agreeing?
I was emphatically agreeing, but I was also thinking back to an earlier point about making choices to go out and meet people, right? Like we often try to make choices to optimize outcomes, right? And when social outcomes are really important to us, then a healthy behavior would then be to go out and, meet people, or go to your daughter's room, or, to engage, call a friend, right? But when we aren't doing that, right? If there's something impeding that or coming in the way of that, whether it's, being really busy at work, or, someone isn't available to hang out, then that could be, you're choosing to behave this way, but then you're not able to.
Right.
But it's not due to you, it's just due to some external factor as well.
I can imagine there's also probably some, like I could walk up to anyone, talk about anything at any time. I have no fear of rejection, but I know what it's like to have that, because I felt that way in middle school and high school. I was that person that wasn't included. So I know what it's like to have fear of rejection. So I can imagine there's a little bit of that associated with it. But going out and choosing to, let's take the gym, for example. Going to the gym, maybe saying hello to someone or hi to someone, no strings attached. If that person doesn't want to talk to you or engage with you, you tried. They're not thinking twice about it.
Right.
Is that like a hard concept for lonely people who maybe aren't the most outgoing?
I think it's person by person, But I think that the other thing, though, on the other side of it is to take a moment to be like, if you're walking your dog in the park and you're someone who maybe is not experiencing loneliness, and someone comes to talk to you, maybe that's why they're doing it, and sort of saying to all of our listeners out there.
This is a great public service announcement.
As a public service announcement, if somebody comes up to talk to you, maybe that's because they're looking for social connection, and maybe take the extra 2 seconds to talk to them. It may make a difference in their day.
It's not a long-term commitment. It may be a 30-second conversation. Yeah, that's really... Okay, so it might be really hard for lonely people to engage, but it's people who aren't lonely, there are things that we can do. So engaging, what else can we do if we think that someone's lonely? Like the lay person.
You mean if a lay person notices someone else is lonely? I think just the common sense stuff, hey, how you doing?
I've learned common sense is not so common. Just so you know.
Yes, that's definitely true. But I think asking them to do something, right? Going out of your way to, hey, you want to grab a coffee? Right? Like if you're noticing in the same way, and I think that this is kindness, right? And, I bet it would have made a really big difference to you when you were getting left out in middle school and high school. Yeah. If someone said, hey, come sit with us. Yeah. Why not?
Actually, I have a lovely story, and I remember this, and it still, like right now, it warms my heart. I've been 6'4" since I was 12. And that's really outcasting. Like that is really, it sounds great now, but growing up being so much taller and bigger than everyone else was really, really uncomfortable. I was excluded from a lot. When I was in 6th or 7th grade, a new kid came to the school. I don't remember from what country, but he came to the school and he looked different. He wore different clothes. And I felt so bad for him because he would go to sit with other people at the lunch table and people would move. And he was excluded right from the start. And so I became friends with him. I sat with him and we kind of got to know each other. And this kind of went on for a couple months. And his name was Igor. And I won an award at my school, like Student of the Month or something. Fast forward, I was at a rest stop on 95 in my 20s. And I ran into him. He recognized me. He came up to me. He gave me a hug and a kiss. And he said, "You completely changed the trajectory of my life." He said, I thought I was so miserable moving to the United States, and you were the one person who gave attention to me. And then, once you kind of moved on, it just moved to other people, and I will never forget how you made me feel. And it was not hard for me. It was very, those simple things can make a really big difference.
And it works both ways too. So I think, so this is actually something that my lab is really interested in is so one of the biggest predictors of happiness around the world is prosocial behavior, right? It makes us happy. It makes other people happy. In general, if you observe an act of kindness, right, it makes the observers happy too. And I think this is also something we could kind of recommend, right? If you're feeling lonely, maybe a easy thing to do is go volunteer.
Yeah.
Right. Find a charity or a cause that you really support. Find a friend, be like, hey, I'm thinking about going to the food pantry. Let's go together. Right. And
offer to walk a neighbor's dog.
Right. And if they're exactly. And I feel like that is a huge thing. It boosts social connection. Social connection also makes us happy.
Right. People like being useful.
Yeah.
And so maybe this is also, not only, I think everyone, just needs to be a little bit more kind. And then,
and again, sort of the importance of what we said before, it needs to be some structure. I feel that the four of us are very kind and we're trying to do better every day, most likely. But it should be a structure. Perhaps that school should have had a program.
Yeah.
Okay. Or perhaps the local pantries need to put information out there. Right. Again, at the individual level, there's so many variables out there. But what we know, and we know from the report points out that, society has some role, and structured societies and structured schools and structured pantries will go perhaps even a stronger way, helping these people. I just wanted to comment, going back to what you said about the gym and social isolation, and that one of the problems about the gym is how much you pay for the gym. So one of the things that we know about who is at high risk of some social isolation and disconnection is that the people that are having some financial struggles.
Right.
So, and that sort of perhaps was exacerbated, with COVID. And it's something that we cannot ignore. So again, when we are recommending these things in the office, we have to be also mindful. And again, we do have, and actually we are very good at capturing social determinants of health. So we're asking these questions. There are tough questions. But, for some people struggling, it really makes matters worse. And they are isolated because of that.
Yeah. Absolutely. I think that's so true. Yeah. And, sort of how addressing those social determinants of health, of which I think isolation is one of the social determinants of health, yes. But how in addressing those social determinants of health, can you also be addressing isolation, right? So if somebody has food insecurity and you set them up to get Meals on Wheels, is that then a social interaction that they have, And so I think that these things are so interrelated.
Yeah. And it happens in New York. It happens. Right. It's not that I'm talking about something that I have not seen. You said people, do not make it till the end of the month. So that's the people that will really not go out.
It sounds like an incredible program that you could have. There's probably people out there that need something or need help with something and maybe don't have money to pay for it. And then there's people out there that want interaction and would be, like watching children or dogs or picking up groceries. Those things might be helpful for someone and give someone else something to do.
Again, so we're talking about the structure. The structure will not come from individuals. It's sort of like the, if you wish, and I don't know if the right word, but obligation from the city, the state, whatever you want, to put the obligation on. But it should come from a structured entity.
Like if the government were to get involved in some sort of funded loneliness program, right? How is that financially helping on the back end? Like, what money is it ultimately saving?
If we follow what you mentioned before, the return on the investment will be there. The statistics are showing impact at so many levels, in so many illnesses. The percentages are so high that one can claim that the return on the investment is there. Nevertheless, just like, somebody has to do the numbers,
Somebody needs, right.
sharpen that pencil.
Right. So now in the world of like AI and technology, you can actually pay for AI companionship. You can put on the Oculus and have conversations with people. So what are your thoughts on like AI companionship or even paying for companionship? Like, so it's something outside of the normal like authenticity type relationship.
I mean, I think this is similar to the social media conversation, right? I think that you don't even have to pay for it. You can go to ChatGPT and be like, hey, how are you? What's your, and have a conversation and then sometimes it gets, I think, it sort of does it cross a line, right? When it gets in the way of you then maybe having other interactions in your life, when you get stuck in that world, that virtual world, that maybe can become problematic. But yeah, I think whatever works, right?
Would you consider playing video games, like, the video games that people play, they play with other people on the line? Would that be considered?
Oh, absolutely.
That's companionship.
It not only is it companionship, that's community, right? I think that so many of these games, especially, and I have to tell you, I have never played any of these, so I may sound very...
I've listened to my son for years.
Yes.
Like, I'm sitting here thinking, like, can't he just get out and hang out with his friends? But he's like, Mom, I'm talking to my friends.
And there's a whole world that you can have there and support systems. And so I don't think that it's like, it has to be it's only equality if it's an in-person interaction at all. I think it's about wherever you feel your needs are being met and how they're being met. If that's AI generated, why not?
Is there any research in that, in like different ways of companionship and interactions?
I would say, so there are a lot of studies where these are just they're not games, but they're just like boring cognitive tasks that we have people do, where they are told they're interacting with another person, and then they're also told they're interacting with just a computer, which is kind of similar to what you're talking about. And the interactions that we see with people are almost always way different than how they interact with computers. Their brain responses are also different.
Wait, say more. Like, kind of give a little more on that.
It's like, if I'm interacting with another person, I might, want to engage and think more about like, what is this person thinking right now? Like, I'm kind of forming a mental model of this person that I'm doing this cognitive task with. But when you're just playing with the computer, that this computer doesn't have any sort of agency or kind of like mind of its own. And so that could be getting in the way of that social interaction.
Right.
And so we do see that, brain regions that are responsible for representing other people's emotions, their beliefs, those are more engaged when people are told they're talking to or playing with another person, great to a much greater extent than when they're told they're playing with the computer. Yeah.
And independently of the impact that you're not moving around, correct?
Right.
So if you're going to play in the park, 10 minutes of a soccer game, correct? You take the elevator, you walk to the park, perhaps you put 5,000 steps, you say hi to the guy in the corner that perhaps you sip coffee on the way back. So all that is just lost, correct? And all of a sudden, if we're going back to the fact that we have an epidemic of obesity and poor alimentation as a whole, I feel like we're going to end up with more illnesses that perhaps would make people lonely because they would be just socially isolated in the long run. That's my concern, correct? I feel it's just, and I have seen it, I don't want to say at home, but I have seen it at home, I guess, where, even some of the activities that the children do, they are with their friends because everybody just like watching them doing the homework. They're so together,
It's just hard for us because
they're
we didn't grow
not
up
moving.
that way.
They're just not moving a single muscle, correct? And this is just so. Are they in good shape? God knows. You haven't moved an entire week out of the computer.
It's really hard being a parent of this generation. You're like, you can't help but judge it to the way that you grew up and feel like it's less than, even though it might not be.
That's every generation, though, right? Oh, back in the day.
Yeah. What is something that someone would feel that it would be like the right time to actually seek expert consult?
Absolutely. So, we mentioned how Loneliness can increase risks of anxiety, increase risk of having a diagnosis of depression. It can also increase thoughts of suicidality. So I think that if you are certainly if it's suicidality, that would be a time that I would absolutely reach out, right? So there, you can call 988, which is a crisis line that you can call anytime, but that would also be, obviously if it's acutely suicidal, to go to the emergency room. But if you're experiencing depression or anxiety as a result of your loneliness, you should definitely seek a mental health professional. And I would say that here at Sinai, we've got a brand new behavioral health center. We've got outpatient services, we've got groups, we've got individual therapy, there's a partial hospitalization and intensive program. There's so many different options to sort of meet people where they're at in terms of how they want to engage in care. But so in terms of when would you do it, I think that when your loneliness is causing these depression and anxious symptoms that are making it so that you're not functioning at the same level.
Or even if it's crossing your mind that should I? Like if it's crossing your mind, should I go see someone? The answer is probably yes.
Why not?
Like the worst they say is, actually, I think you're doing okay. You don't need any.
Or the worst they say is, hey, this doesn't sound like depression, but it does sound like you're really lonely.
Yeah.
Right? Let's talk about that.
But what does that mean for maybe like patients with Medicaid or without insurance? Can they still get help?
Oh my gosh, at the Behavioral Health Center, we take Medicaid, we take Medicare.
Okay.
You can absolutely get help. I think it is something that Mount Sinai views as really important, that we have access to care that is not dependent on your ability to pay for it.
Okay. And you found a statistic that you wanted to share with us. Do you want to find that and share it?
Only when you were asking about the, would it make sense investment-wise?
Right.
To,
well, because I know how
the country
government works, or anything works.
And so, it's thought that the economic cost of loneliness is $6.7 billion.
Wow.
Right? And most of this is through Medicare spending and nursing home. Right? So I think that in terms of would there be a return on investment? Yeah, absolutely.
So we learned a lot today about loneliness. We learned that you can be a very healthy individual with no medical or psychiatric disorders, and you can be lonely. Loneliness is not something that like you experience for just like a couple hours once. We call that solitude for people who enjoy it. But loneliness can be really bad for your mental health, for your physical health. It can lead to death, early death in some people. It can make you ill in the hospital. It can lead to really, really bad things, right? But we also came up with some really easy fixes for it. Should someone be able to take those fixes, like going for a walk, going to the grocery store, going to a gym, asking to help walk a dog, or just have a conversation with someone? What would you say is like the one big message that you each want to get out about loneliness that you could leave our listeners with?
I think my biggest message would be, if loneliness is resulting in you having symptoms of depression and anxiety, you should get help. There are clinicians who are available and interested in helping you. It can't hurt to reach out.
Okay, great.
Loneliness is more than a bad feeling, and it should be part of the regular visit to your doctor. I mean, we learning, how to do it better, but we have enough access at Sinai for you to come and just talk about it.
Great. Okay.
I think there are huge costs to loneliness, but I think we also want to think about the huge benefits of social connection in general, right? Whether it's, being able to help someone who needs their medication, whether it's, enjoying the things that you love to do.
I consider myself an optimist, a happy person. I'm like the opposite of a lonely person. However, I feel like lots of people are like this, especially like busy working people. I could make plans 2 or 3 nights a week, but when it comes time for the plan, I don't want to do them. I just want to go home and be alone, and I don't want to talk. But I remind myself in that moment that it's fun to have fun. It's fun to have social connections. Mm-hmm. So I can see how people who like you cancel once and you don't make a plan and you don't reschedule, how that can actually turn into loneliness, because I've actually purposely not made plans, and then I find myself being like, how come I wasn't included in something? So that kind of goes back to what you were saying before, is like social connection is good, but you have to do it.
Exactly. Yeah.
It takes work.
It's hard work to not be lonely.
It's hard work, but I think it's hard work to do physical activity to stay healthy. This is the same thing, right? It's hard work sometimes to be socially connected to help you stay healthy.
So social engagement in preventing loneliness is akin to going to the gym and doing squats.
It's what? Sorry, I love that.
If you want to get strong, you go to the gym and do squats. If you don't want to be
Yeah.
lonely and you want friends, you have to show up.
Exercise those social muscles.
Exercise the social muscle.
And again, there's an obligation, I think, not just only at the individual level, but as a society as a whole, to create the structures to prevent this. If we're talking about an epidemic, by now we know that we don't respond properly to epidemics or pandemics, we pay a high price.
Yes.
So if we call it an epidemic, we need to have the responsibility to, at each level, respond the right way.
Right.
And I think it's important to take time to nurture your relationships, right? To take time to nurture your friendships, your relationships, your family relationships, right? Like I was saying, it takes work, right? But the benefits are worth it. And then also another thing is that maybe you don't have to increase the amount of social connection, but maybe put your phone away when you are having these social interactions. Increase the quality of the interactions that you are having.
Right. Yeah, we have to remind ourselves. When I'm out at dinner with my family and I'm thankful we have good conversation, I get sad when I look at other tables and everyone's just sitting on their phone and no one's communicating. It's sad.
It's very sad.
Yeah, so hopefully we can get away from that. Well, I want to thank you guys for being here today. I think the biggest message that I hope our viewers and listeners take away from this is feeling lonely, being nervous that are you lonely or maybe there's something else going on is absolutely a reason to call and schedule an appointment with your doctor. If you have a primary care doctor, that can easily be your first phone call. If you don't have a primary care provider or you're not sure who to call, we have some great information here. We'll put it back up on the screen on how to get a behavioral health consult. And it's okay to call and say, I'm lonely and I'm looking for help. So thank you again.
Thank you.
Absolutely. Thank you.